Part of the Elderwood community of care is their Seasons. It's for people with memory impairment. So here with more details, we have Sandra Burroughs, who is the Director of Memory Care, and Sabrina Wilson, the Director of Activities at Elderwood on Grand Island. So good morning, ladies. Nice to have you here.
Thank you for having us.
It's so important that you do what you do. Sandy, maybe you can tell us, how does caring for people with dementia differ for caring for people without memory impairment?
Memory impairment brings about a new personality for the person, and so that which you trusted was their likes, dislikes, their answers, their ability to think and to do things, those things are eroding, and pretty soon they're going to be gone. And so the person that you thought you were dealing with, you're not dealing with them anymore.
And when we were just talking about this before the show started, we're talking normally about family caregivers who have been with this loved one for quite a while, and they're seeing this, you know, like you're saying, this eroding of memory. And it's got to be a difficult call for them to finally call and say, I can't do this anymore, I need some help. But that's exactly what you specialize in. We
do specialize in that, and we do an assessment process as well as looking at the life story of the person, so that they don't give up their life, they actually bring their life in, and that is the core part of the programming, and Sabrina will tell us a lot about that.
And I'd like to hear more about that, Sabrina.
Sure. So our Seasons programming is based on their personal interests as well as their past occupations and their current level of ability to function through their daily life. We use the seasons of the year to help us stage where they are in their journey with dementia. Some of our programming will be life skills, such as sorting and folding laundry, helping to set the table for that ladies' tea social, as well as sensory stimulation programming for those in the lower level. So we start out with spring, where they're higher functioning, and we go through the seasons all the way to winter, where it's lower functioning, and they really need that one-to-one programming, especially with the sensory stim. If
someone is with the season program, are you there as a resident versus staying at home now?
Yes. It's an in-facility programming. It allows us to make their day have more continuity to it. Coming and going from daycare is great in the earlier processes of memory care, but there gets to be a point that it is so stressful for the caregiver that they're providing care rather than having that relationship as wife or daughter or children.
Absolutely. When is secure memory care appropriate?
Secure memory care is appropriate when there's dangers within the environment that will, you even have on your television alert, the look for this person because they've wandered away. So we're talking about safety at home, we're talking about leaving their car, not knowing where to go. So that's safety.
Can we assume that there are availabilities in the Seasons program now for people who might be watching and are concerned about their loved ones?
Yes, yes, there are. So if people are interested in our memory care program, please check out elderwood.com and give us a call.
Listen, for a lot of people, they might be sitting back going, this is exactly what I hope to hear today, because they do have loved ones, and this is a very tough thing to go through when you have a loved one and you just can see it change on a daily basis. But to know that there are people who care and will work with your loved one and will feel for them like you do is a tremendous comfort. We want to thank Sandra and Sabrina from Elderwood. And as we leave you, let us make sure that you call or log on today for more information. That would be their Seasons Memory Care program at Elderwood.